All right, in the interest of time, we'll get started. I want to make sure that we have plenty of time for this conversation. So first things first, I will welcome everyone to this webinar. I'm Krista Lamb, and I will be your host today. To start, I will say that IHSTS and the Type 2 Diabetes Network, which does its work throughout the province, would like to acknowledge that we are living and working with humility and respect on the traditional territories of the First Nations people of British Columbia. So to start our event today, I'm going to pass the microphone to the CEO of IHSTS, Kathleen Chouinard, to tell us a little bit about the Type 2 Diabetes Network. So thank you to Kathy for joining us.
Good afternoon, everybody. Thank you so much for joining us. I am the CEO of the Institute for Health System Transformation and Sustainability. You may or may not know, we are a small NGO located in British Columbia. We have been focusing and putting a tremendous amount of effort on a type 2 diabetes strategy over the past couple of years. We have a type 2 diabetes network that is up and running. The focus of this network has been on type 2 diabetes education, and more recently, starting to think about focusing on how we could influence stigma of type 2 diabetes across the province. We are connected nationally, and I think the sky is the limit in the work that this network's going to do over the coming year. It is with great pleasure that I can introduce Krista Lamb. She'll be moderating the session today. Krista is a science communicator who specializes in translating complex topics into interesting and understandable stories for diverse audiences. Her first book was called Beyond Banting, and was released in 2021 and went on to win the Science Writers and Communicators of Canada Book Award in the general public category. In addition, Krista has been the producer and the host of multiple podcasts, of which several of them have been through the Type 2 Diabetes Network, but all through other kinds of agencies that are focusing on Type 2 diabetes. She has an award-winning Diabetes Canada podcast called From Beta Cells to Bicycles for the BC Diabetes Research Network, and how to talk about health. So I'm going to turn this over to Krista, and she is going to introduce our speaker for today. And over to you, Krista.
Wonderful. Thank you so much for that introduction. So first things first, I'm going to let our audience know that this is a special format. We do this for these events. We call it a vodcast because we're doing sort of a video podcast. So there won't be any PowerPoints. You're not going to have to pay deep attention to your screen. We welcome you to watch or listen or both to this conversation. We also highly encourage people to ask questions. Please put them in the chat box throughout the conversation. We will have a spot at the end where you can have your questions answered by our guests. So we really want to encourage you, for those that are watching live and the people who will watch afterwards, if you have a burning question, make sure you get it into the chat. So with that, I will introduce our guest today. Dr. Diane Finegood is a professor at Simon Fraser University, where she's also a fellow at the Morris J. Wask Center for Dialogue. She applies systems thinking and dialogue to address complex problems across a broad range of topics, with a particular focus on health systems and public health. Her most recent work has been supporting the Public Health Agency of Canada in public engagement to inform a framework for diabetes in Canada. Following the tabling of the framework in October 2023, Diane is leading further public engagements towards the implementation of the framework. And today we're going to be talking about stigma and diabetes. This is another area of her research, and it's one that I also have a particular passion for. So I'm very excited to have this conversation with her today. Welcome, Diane.
Thank you, Krista, and thanks for the invitation.
Well, let us start. I think the first thing we should do is talk about what is diabetes stigma. Let's level set for those that might not even be aware that this is an issue, because for many people, they don't think about diabetes as a stigmatized condition.
Well, maybe we should start by just talking about stigma in general, and stigma being a set of negative or unfair beliefs that people hold about individuals because of the mental models, the way they've been acculturated. implicit assumptions arising from cultural norms and fear and misinformation all go into creating our mental models, and those mental models often stigmatize other people, be they people living with diabetes or other identifiable aspects of our intersectionality. So I think that's part of the challenge. With respect to diabetes, there's some interesting nuances on the different kinds of stigma that people experience, and some of it is not surprisingly associated with obesity and obesity's relationship to type 2 diabetes for individuals. Interestingly, people with type 1 diabetes feel stigmatized by that and people's lack of understanding that it's not, that it's a genetic disease, type 1, that they receive their diagnosis as a result of loss of their insulin producing beta cells. I think it plays out in all kinds of ways in our healthcare environment, in our families, and in our communities.
Yeah, and I think it's a really good point that you make, that oftentimes we don't really realize the impact that stigma has in our lives, but it's so interwoven. And how many people are impacted by diabetes stigma? I know you've recently done some work on this, and what was the response in terms of how many people are actually experiencing that?
Well, Diabetes Canada ran a national survey on the social experiences of living with diabetes. And if I recall, I'm not really good at remembering numbers, but if I recall the numbers correctly, it's something like 86% of people with type 1 diabetes and nearly 70% of people with type 2 diabetes feel blamed and shamed for having the disease. And in neither case is this someone's fault. It's the result of a whole bunch of different factors that affect an individual.
Yeah, one of the things that I spend so much of my work doing is talking about how this is not your fault, but diabetes is one of those conditions where, regardless of why you have contracted, what's another way? No matter why you have it, it really isn't your fault. There's so many things that go into this. And so why is stigma such a problem? What are some of the impacts it can have?
Well, the consequences of stigma are manyfold. Judging people for their lifestyle and social exclusion, being unable to disclose their condition at work, anxiety and self-consciousness about managing their diabetes, especially in public, where although this might be changing a little bit now, using a needle in public to give yourself insulin, people have talked about being considered a drug addict or thrown out of restaurants. Avoidance of healthcare, and if you avoid healthcare because you feel stigmatized by your healthcare provider, then you're less likely to be able to maintain good diabetes management and good care. Strained relationships with family workers and others, and even career limitations. So it runs the gamut, really, of how stigma of any sort can impact our lives. But in this case, the stigma associated with a condition like diabetes goes further because of things like giving yourself insulin in public, that sort of thing.
Yeah, I will never forget having a friend with type 1 who, after an event where he had a low, there were all of these people talking about how he had been so drunk at the party. And we were like, no, he doesn't even drink this. But it was this obvious sort of like, we never think of the other reasons why a person may be having these impacts. And so these are all really good and important things. I think in particular, so often we talk about how people have been stigmatized for using their diabetes needles and items in public, and that is such a heartbreaking thing whenever I hear those stories, because the last thing you want to do is dissuade someone from doing the type of medication and self-care that they need to in order to stay healthy, and in many cases to not have that horrible low or to not have that issue. So however, in the diabetes world, we know very clearly that it is still one of those things that people feel very comfortable stigmatizing. We know that people feel very comfortable judging people and saying things like, we call them the diabetes police for those who are listening, the people that come by and explain how you should be eating if you live with diabetes and how you might want to consider or the plate, that's a plate of diabetes, all of these things that we put on people. So Diane, I wanted to ask you why you think from the work you've done that it's still considered okay to have these beliefs about people with diabetes culturally.
It's a really good question, Krista. I think part of it is a result of lack of awareness. Some of the people that we talked to during the course of this work, even people with diabetes, weren't aware of, weren't thinking about their interactions as stigmatizing. And in conversation with people, we came to understand that there may also be an internal suppression, if you will, of that, or an internalized stigma where you don't even recognize people's behaviors around you, like the diet police who look at your plate and question what you're eating as maybe they're right, self-stigmatizing, blaming themselves. It reinforces that notion of blame and shame. And so I think you're absolutely right. That compounds the problem in many ways. Why else? Well, if I zoom out on the problem a little bit and I think about it from the fact that our world is so incredibly complex and we as individuals really, can't deal with all the information and misinformation that we're getting. It's getting even more challenging. It's easier to rely on a kind of a preconceived notion or how we used to think about this, or what our culture has told us, or otherwise. I remember I had a grandmother with diabetes who's, called it a touch of sugar. That notion that it's not serious is conveyed in that kind of a statement. And if you don't think it's a serious disease, one that you actually have to pay attention to every day, every moment of the day, in some respects, as you eat and take your insulin or other medications, that functional control of your blood sugar is a lot of work, and most people don't realize it. So it's much easier to kind of resort to stigmatizing perceptions that it's not that hard. Oh, you're making this up. Why do you need those accommodations? Everybody else can manage. So those are all aspects of it that I think are part of what contribute to to stigma and to the challenge.
Yeah, and one of the things that's really interesting that I found in my work with the diabetes community, because I don't live with diabetes, so there were many things that people brought to my attention that I would never have thought about. For example, oftentimes people with type 2 diabetes are considered, like they have the one that they did to themselves, or they have the one that is worse because they could have fixed it if they tried, which is absolutely untrue in the sense that many people have no control whatsoever over why or if they develop type 2 diabetes. But it's this stigmatization, even between people sometimes with diabetes, that causes a lot of concern. And so I wondered if you found anything when you were talking to people about this in regard to this sort of concept that people with type 2 have, quote unquote, done it to themselves.
Yeah, so lots of people bring up the notion that is part of their experience, that sometimes they also think that themselves if they have type 2 diabetes. But really interesting to me, something I was totally unaware of before starting on some of this work, actually for the framework, is the stigma that exists between type 1 and type 2. So people living with type 1 feel burdened by the stigma, as you articulated, that is normally applied to people with type 2 because of obesity and the notion that they might be able to do something about it themselves. And so there's a tension in the diabetes community between people who live with type 1 and not wanting to be lumped in with people with type 2 because of the stigma that people experience.
Yes, it's one of the things that I always feel very bad about, because I think that everybody's diabetes is their own journey, and it would be wonderful to see so much empathy, but it's also a very understandable thing. And we've touched on this a few times, so I think it's a good time in the conversation to ask you about obesity and what you learned in terms of weight bias and weight stigma, because we know that people living in a bigger body, and I was one for many years, it's one of the most judged conditions you can have. So if you're already feeling very judged because you are in a bigger body, and then all of a sudden you also have diabetes, it can be, I assume, a really challenging position to find yourself in. And so I wondered what you learned about weight stigma and diabetes stigma.
Well, they're certainly connected, deeply connected, and I think it's one of the overriding aspects of it. And the stigma associated with obesity is something we've been reinforcing in the medical system for a very long time. The concept that one should just eat less and move more to address what is also a genetic condition, obesity, has been prevalent for a long time. I mean, I've done it to myself most of my life, and I experience it now in other ways. So I think, I don't know that you could tease them apart. There are things specific to having diabetes that we've already talked a little bit about, but there's a deep overlap. If you think of the Venn diagram, deep overlap between obesity and weight stigma, as well as stigma associated with type 2 diabetes.
And one of the areas about this that I think about a lot, because it's an area of research interest of my own, is the difference between shame and stigma. Because I do think that there is a very deep amount of shame that we put on ourselves when we live in a bigger body, or we, develop a condition that we have been conditioned to believe is something that we've brought on ourselves, regardless of whether that's true or not. It can be very hard to not fall into that shame spiral. I have been there. I have done it to myself. So I know how easy it can be, even when you are, teaching this stuff and talking about this stuff all the time. So I wondered what you learned about shame, or if there was anything about shame that came up when you were talking to people.
Well, I'll just to nuance it. I mean, so I'm taking shame in your language to be how we treat ourselves and how we feel about the stigma that we might be experiencing. Certainly, there's deep connections between our experience from outside and then how we feel about ourselves. One really interesting learning from my point of view was the stigma that led to deep shame in a pregnant woman. So we heard a story of a woman whose physicians, whose healthcare providers made them worry about the implications of their diabetes for their unborn child, and really tried to scare them into making sure they looked after their blood sugar, because otherwise they would be at fault for affecting the health of their unborn child. That level of deep stigma and then self-shame didn't help this individual control their blood sugar. It led to much more mental health anxiety and challenges than I'm sure anybody would like to see. It wasn't helpful. So the impacts of shame in that case are maybe in the extreme, but absolutely affect individuals who are not pregnant and those who are. But it was a good example of how powerful that feeling can be, and how it can lead to anxiety, mental distress, and other challenges. It's enough to recognize that a person has diabetes and the mental stress that goes along with diabetes management. Individuals don't need any more stress and anxiety associated with being stigmatized for having the disease.
Yeah, I think that that's very true. I worked with the WHO on one of their perceptions studies on diabetes. And I always say that there was a woman in that study who said, I was so embarrassed and ashamed to be diagnosed with type 2 diabetes that I haven't even told my husband. And I feel like that woman lives rent-free in my head forever, because just the thought was so heartbreaking that someone would feel that much shame for something that was entirely, in many ways, out of their control, and something that is a condition for which we have so many wonderful treatments now and so many options so that you can live a healthy life with diabetes. And so that was, I can relate very much. And one of the other things that came out of that study was the impact of these misperceptions about diabetes having had on people's mental health. And that's something you just mentioned. So I wanted to give you a chance to talk a little bit about the impact of stigma on mental health.
There's other forms of stigma that we haven't talked a lot about. But for example, a person with diabetes can live a normal life, and yet there's the perception that they can't live a fulfilling life that's normal, that's just like everybody else, because they do have to manage their diabetes, and that's something that takes time. But that's another form of stigma that's not helpful. It doesn't encourage and support an individual. It doesn't create the conditions in which that person can live a normal life and can be just like everybody else and do all the things that other people do. So I think it's important to recognize it isn't just about the shame of obesity, but there are other aspects of this that are, I think, pretty important.
Yeah, absolutely. I think that's so important also to mention. I know for some people, even it's the stigma around using insulin.
Yeah.
So once I get to the point where I have to use insulin, I have failed, is something that we hear a lot in type 2 diabetes. Yeah. People think that if they have to go on an insulin, that they have gotten to the point where they are, they have not done a good job managing, when in fact, as the amazing Dr. Alice Chang once said, it might just be that your pancreas is pooped and it has, it needs a little bit more help to do its job. And we are so lucky that we have opportunities for us to do that and to help you. So all of these things that are part of diabetes that we don't hear a lot when someone's talking about having cancer or having epilepsy or having a different condition. And I know in your work that one of the things you touch on is the impact that media has. And so I wanted to also give you a chance to talk about that, because it comes up a lot, where diabetes is one of the only conditions people still feel comfortable joking about, where a director wouldn't cut it from a movie scene if someone made a joke about diabetes, where I don't know that they would make a lot of cancer jokes. So can you talk a little bit about what you learned from that?
Yeah, I mean, I think you're absolutely right. That is a component of stigma and a component of people's lives, that they have to experience that. What do we learn? I think we learned the same sort of things that you're talking about, that people experience it in a variety of different ways. They internalize it in a variety of different ways, and as a result, there's consequences that that we may not think about. We don't talk about it very much. I mean, it's a very prevalent chronic disease, and yet it doesn't get a lot of, I'll call it sort of press, if you want to put it that way. One of the interesting reasons for that is that most people are not recorded as dying of their diabetes. The mortality comes from things like heart disease and other strokes, other things that are complications of diabetes. We don't talk a lot about the neuropathies and the blood vessel disease that can be created. So it doesn't get that kind of press. As we said before, people don't talk about the stigma of it very much. And all of these are important to uncovering where there's discrimination in the healthcare system. One of the things that was really important in the work that we were doing was to try to understand how mental models impact the structures that are around us, and how those structures and the systems then impact what we see on a day-to-day basis. So, things like the healthcare environment, being stigmatized by a healthcare provider, not providing access to education programs, or thinking that they're relatively superfluous when in fact they're quite critical. The current algorithms and norms for both traditional and social media. We all know this is all about clickbait, and clickbait is the stuff, the headlines that are sensationalist, the pictures of obese people, those kinds of things. In social media, I'm not a big follower of social media as it relates to things like Facebook and otherwise, but I can only imagine that with the growth of influencers and people talking about all kinds of diet supplements, that the growth of that industry just adds to the difficulty that people experience.
Yeah, and I think even the news media, where we're talking about, serious journalism, we often see like those I feel so horrible every time I see those images of people's large bellies holding sodas on a news story about diabetes. And I think, oh my God, what if that was your belly? Like, number one, like they cut your face out, but this is what we put whenever there's a story about diabetes, is these images that really play into the stereotypes, even in our, in our serious news media. So beyond everything you're seeing in social media, it's so ubiquitous in our community to just assume that, this is the person who is with type 2 diabetes.
There's a longer history of trying to counter the stigma associated with weight alone, let alone diabetes. And the Canadian Obesity Network has done, I think, a really good job, along with colleagues in the States and elsewhere, of trying to raise awareness of this stigma and get changes. And so, nowadays you see the big belly, but you don't see the head. But it's not that long ago that you got the full picture. And so they've worked hard. And nor do you ever see very often, although Canadian Obesity Network has developed it, obese people having fun, being excited. And in fact, if anybody's looking for pictures that are more positive, the Obesity Network has created a series that I think can be quite useful, trying to slowly shift media. But as we know, media is driven by clicks and views, and it tends not to get the attention that some picture that horrifies a person does.
Yeah, it's unfortunate. And I think that leads me nicely. One, it's going to lead me very nicely into saying to all of the people who are attending and the people who are watching this later on, that we will have Obesity Canada as one of our guests on this series. And so we're really looking forward to that and talking about some of the things very specific to obesity. And we've been talking a little bit about self-management and how all of this impacts self-management. But I'm really curious about what you found, because we know that when people feel embarrassed or stigmatized by their condition, that they might not be willing to do the self-care they need at work or anywhere. And so I wondered what you found about that.
Yeah, so I think that comes in a bunch of different levels. It can be as challenging as not disclosing to your employer that you have diabetes for fear of losing your job. We heard people talk about how if they needed, 5 minutes to go manage their blood sugar, or they did it at their desk, that employers didn't like that, didn't want that seen in the environment. We heard about people who really struggle with doing that sort of self-management in a public space. We talked earlier about how in a public space, if you're giving yourself an injection, that can be a problem. But we also heard the other side, and we heard from individuals, a young woman who's been artistically creating covers for their glucose monitoring device, so that in fact that they can proudly show it off. Diabetes Canada has a fashion show, or I can't remember what it's called. I'm forgetting. You'll probably remember, but
Some couture.
Thank you, pump couture, so that people would show off their devices and with great pride. So there are people trying to celebrate the management of diabetes in that way and bring a much different kind of mindset to it. And I think that's actually super important. And making people aware that workplace norms and policies may prevent people from being able to self-manage. So, and I guess, and the same thing that we've been talking about in terms of shame, if you're feeling shamed, your self-management may not be as careful and thoughtful as it could be. You may want to try to avoid it or avoid seeing your provider. So those are all consequences of both the stigma and the shame.
Yeah, and I think that those are wonderful examples. And they're also examples of how people with lived experience have really been able to reframe and change the conversation around this. And I wanted to ask you about, I know Diabetes Action Canada, Patient Partners, they all played a role in this work. And I wondered how lived experience supported your research in this area.
Well, most of the data that we collected in the report that we produced for Diabetes Canada was talking to people about their lived experience. But I'll tell you a little story. I also I had some students when I was teaching in the fall of 2023 working a little bit on this project, and one of them developed a comic strip in which she told the story of her experience of talking to a close friend about their diabetes. So this was in a racially vulnerable community where this individual had been sort of, the culture was, oh, you know, I'm a diabetic. And so the language, person first language was not a strong component of it. And they feel like, you know, they felt like diabetes was something that they just, a burden that they had to carry, I think is probably the way I would describe it. And so this student, after becoming more aware about things like person first language, said, no, Auntie, you are not a diabetic. You are a person living with diabetes. And that communication really shifted the mindset of the individual with diabetes. And the story this student told in a comic strip that she wrote up about this was how a week later she talked to her auntie, and the auntie said, you know, people have been, actually, no, she talked to her friend of the auntie who said, you know, Auntie's changed a lot. She's changed dramatically. Now when people tell her she's a diabetic and she shouldn't do this or do that, she says, no, I am a person living with diabetes and these are my choices. So that idea that you can shift a person's mindset really quickly is really important. And by telling these kinds of stories, we can get a more positive environment, I think, for people living with diabetes.
Yeah, absolutely. I love hearing these stories because so often, especially with older generations, they've had so much time to absorb all of those feelings and stigmas and misperceptions, and having someone come in and say, no, let's do it. Let's think about it. Let's reframe how we're thinking about it. Can be so impactful. So that is amazing. And speaking of impact, I think we'll transition now to the portion where I ask you about what are we going to do? Because we established that we have a problem, but what are some of the things that, for example, many of the people who watch this will be healthcare providers. What can they be thinking about in their own biases about how they can maybe do a better job of being less stigmatizing?
So I think there's a lot to be said for humility and the recognition that the person with diabetes is more an expert than the healthcare provider in that individual's diabetes and in their experiences. And we should empower people to be even more knowledgeable about their own diabetes. So I have some colleagues in IDEA Diabetes who are working on a project called Unlocking Hope, where they talk about protecting our blood vessels. They talk about recognizing that that giving people scary information often isn't very helpful. They talk about how individuals have to understand, doctors, healthcare providers have to understand their patient's set of circumstances. And the challenge, of course, is not all patients are the same. Everybody is a unique individual, and many of the things that that affect how they respond to their diabetes and the stigma are things that you don't normally ask in a healthcare setting, right? They're things like, you know, what drives you to take insulin, or why is it you don't want to take insulin? Maybe that's a question that gets asked in a healthcare setting, but it isn't necessarily questions about how do you feel about technology, what are the different ways in which you experience medications. There's a variety of different things that make us up, and trying to understand the individual, I think, is a really important component of this. I think we probably need to help. We need to find some tools that will support a wider conversation about how a person is feeling, what their experience is, what they know about their diabetes, so that a healthcare provider can tailor their approach to an individual. Another story, which you may have heard from elsewhere, that always strikes me is the one where an individual healthcare provider gives a patient their diagnosis and then goes on to talk about their treatment plan, while the person is sitting there going, diabetes? I'm not obese. Without, that's a serious disease. What am I going to do? It's my fault. And the healthcare provider hasn't stopped to say, how are you feeling about the information I just gave you? They just rabbit on about the treatment plan that's going to be undertaken. And so just having a bit more focus on the individual and where they're at is really important. And looking for ways for people to support people to learn more about their own diabetes, understand how different foods affect their blood sugar. All of those things I think are important, but it's about support, encouragement. It's about humility and recognizing that an individual with diabetes has lots of information that the healthcare provider doesn't have about their experience.
Yeah, I think that is so important. I know as a person in a larger body, even going to the healthcare provider can feel very fraught. And I know people with diabetes have said the same exact thing, that you go in and you often feel nervous about how you're going to be talked to, about whether or not they're going to talk about, whether you had poor control, which is such a horrible way to talk about someone, taking care of a really complex medical condition. And so I love that we're starting to really reflect in the healthcare field about how we talk about these conditions and the ways that we can do so in a less stigmatizing way. So I think those are really good and important things to think about. And what about our friends and our families, those of us that don't live with diabetes, but are having these conversations? How can we avoid stigmatizing or being shaming of the people that we love and who in our heads we're just trying to help, but we're often not being helpful?
Yeah. I mean, again, it is about being supportive, but it's also about being educated and understanding the needs of the individual, not policing the individual's behavior, but supporting them to make good decisions of their own, recognizing it's an individual's choice. Helpful conversations are more likely to happen with people you trust. And so family is really important in being a supportive environment for an individual who might be experiencing considerable stigma from outside. But having a family member watch what you're eating and suggest, no, you shouldn't be eating that, usually comes from a person who knows less about the disease than you do. And there's also a really interesting challenge in this regard around families when we're talking about individuals who are diagnosed with type 1 as young children or infants. When they get to their teen years and their transition to adulthood, that fact that the parent had to be very conscientious around their child's diabetes when they were young is a hard transition. It's hard to transition out of for the more adult child who now is, embarking on their own world. And so being conscious of that, I think, for family members can be really helpful.
Yeah, I think sometimes it can be so hard to break out of those notions that you need to be monitoring the person all the time. And so I think for many of the parents of children with type 1, when their child is no longer a child, they can also forget that they no longer have to be as vigilant. So interesting. And I am going to say to our audience who are here with us live today, if you do have a question, please put that into the chat. We're going to be doing the Q&A portion in just a moment. And before we do that, though, I'm going to ask you if there's anything about this topic that I haven't asked you yet that you think our viewers and listeners would want to know or should know about this topic.
So I think, to change, to really address stigma, we need to change the conversation, the tagline from Diabetes Canada's project. But what does it take to change the conversation? It takes trusted relationships. It takes an actual relationship to start out with, for an exchange between people to be really helpful. Yeah, we can educate people, we can do all these things, but honestly, real change comes from being supported by people you trust. And so building trust in healthcare, building trust within our workplaces and our schools, in order to be supportive of individuals. I mean, this is true across a wide range of areas, but it's particularly true with diabetes, which for some requires day-to-day, hour-to-hour kinds of management. And so being supported, a young person being supported in school to measure their blood sugar and take their appropriate medications is critical. An individual in a family is needs to be supported. So we need, because trust is important, we kind of need to start in trusted relationships and then have positive conversations that illustrate your support, that learn to try to figure out what are the things in our systems that need to be changed. Where is there a policy that's not helpful and that could be changed, that have little to no consequences on the company? Those are the kinds of things that would move us, I think, in a better direction. But it is that challenge of, well, everybody's an individual and unique, and yet not stigmatizing people associated with weight is a broad concept that's really important. Not the only one, but it's an important one.
Agreed, definitely. And so now we will turn to audience questions. And the first one that I have is, what inspired you to actually look into this? What was it that made you interested in this topic?
Well, at the time, I was actually a member of the board of directors of Diabetes Canada, and the topic came up in our discussions there. And I thought, well, this is important. But I also was particularly interested because I'll call myself a complexity researcher or systems thinker. And so I'm super interested in how something this complex can be unraveled in a way in which the healthcare system might be able to do a better job. That's one of the things that sort of drove me. And I think that's really important. So it's kind of my interest in complexity. And plus I've been in the diabetes space all my career. I was actually a basic scientist in the early days, and just actually had my own stigmatizing thoughts corrected recently. So back in the day, I studied metabolism, and very popular was the thrifty gene hypothesis, and the work of a professor at Western Ontario finding a gene in the Sandy Lake Reserve. And then I went on and did some other stuff. So I didn't follow that particular thread until recently, in conversation with my colleagues in Idea Diabetes, I came to realize, thanks to them, they provided a paper in which much of the thrifty gene hypothesis was dispelled. And what I came to really understand is just the fact that somebody found a gene common to a number of individuals in a community and then use that as a single explanation is a problem, right? It's a problem because it reinforces stigmatizing stereotypes. It illustrates how stigma associated with being Indigenous is then exacerbated by finding of this gene and saying, oh, it's not, in this case, it's not their fault, but they can't do anything about it, or however that hypothesis got played for many years. So we're all on a journey. Well, I'd like to think we're all on a journey to try to uncover these biases, but even somebody who spent a lot of time thinking about it still makes mistakes, for sure.
I love that story. And there's a book that's out, and I'm blanking, of course, on the title of the book that talks about the thrifty gene and about so many of the biases and misperceptions that science can sometimes put on to a condition. And it's not necessarily coming from a malevolent place, but it's just that it's very easy to, when you're looking for an example or a solution or a reason, to kind of fall into those biases. So really, really great point. And I have another question. Sorry, I'm going to take this one first, though. Are there any places and resources for healthcare providers based on your work, or just in general, that you recommend for healthcare providers in this looking for suggestions?
Yeah. So I asked about this question when I talked to healthcare providers. I didn't talk to that many. I think there are individuals for sure who are out there who you can learn from, people like David Campbell at the University of Calgary, who has worked with homeless populations and as co-researchers, and they produced a fabulous movie about the stigma associated with diabetes and homelessness. And so if you really want to have your mental models changed and recognize why it's so important, that's a good resource. I think the challenge is that there's some more work to be done. We certainly, because of my interest in complexity, have been developing ideas like a deck of cards. So just imagine, I saw this about 20 years ago, and I've lost the deck that I was given, but it was a deck of cards with statements from individuals who have diabetes, like, I don't like to take my insulin. They were honest, true statements, and there were like 40 of them. So no one individual had all of these considerations, but they were the kinds of information that could be helpful to a healthcare provider, particularly one that might be working on mental health with an individual, so a counselor and that sort of thing, to really unpack what's going on for an individual. What is it that creates the challenge, or what does a person want to work on? So if an individual has, a dozen different things that are challenging them, you can't work on all of them at once. It's too much. You need to pick out the things that are most important. So through kind of an inquiry approach, using tools that stimulate people's thinking about the broad range of things that might be going on for them, I think we could do better. The challenge, of course, is getting all the way to producing such a deck. It's not a simple matter. Don't know that anybody's going to fund it, that sort of thing. So the deck doesn't exist as far as I know, but that would be my recommendation for where some of this work should go.
That's a really great suggestion moving forward. And it's funny, Joanne had a very similar question about resources to change that conversation. And she also asked if there have been any lessons from the toxic drug supply and the work around reducing stigma that we can borrow.
Well, I don't know about the toxic drug supply beyond the effort of people trying to call it a toxic drug supply as opposed to an overdose crisis. So I think calling it what it is, in that sense, that it's about the toxic drugs, is helpful, although I don't know I don't know enough about how far that impression has gone. So where we can find ways to change how we frame things and spread those frames is really important, because one of the things I know from my work in complexity is mental models are the hardest things to change. But if you change them, they're the most powerful. They can have the most impact on how things operate and what goes on. People, it's hard to unsee things once you've seen them. I think about the story of an Indigenous mother who I heard. This is about racism, and it was about her experience of having to take lessons in childcare, because her mother, who was a residential school survivor, didn't know how to parent her. And immediately for me, that was now I get intergenerational trauma. And I suspect there's a certain amount of intergenerational trauma associated with diabetes as well. So uncovering those aha moments, helping to spread the stories, I think that can be a very powerful way to change the conversation. And as it relates to mental health, we know that there's been some impact of things like Bell's Let's Talk campaign. I think a campaign by itself, without really trying to have conversations to change the conversation, may not be as helpful as thinking about the structures we could put in place that would enable more people to have healthy, positive conversations with others.
I love that. And Kathleen has a question, and I think it's a very wise one for you with your experience in healthcare and advocacy to the political side of things, which is, she's hearing this as a discussion that needs to happen in 3 layers: how we treat ourselves, how we treat others, and policy that impacts stigma. So we at the T2D network are looking at looking at stigma. And so she wanted to know, from your experience and expertise, where do we start to influence this at a provincial level?
That time matters. The moment in time matters when it comes to changing government or even the health authorities. I don't have a good answer to where to start in policy beyond trying to actually create a movement, in a sense, for destigmatizing diabetes. I'm glad to see that the Type 2 Diabetes Network is going to focus on this. I suspect, I would hypothesize, that the efforts of Diabetes Canada to raise awareness about stigma through its Changing the Conversation project haven't hurt in getting, say, the Type 2 network to give it a focus. So I think creating that focal point and finding those stories that, when spread, really help to change people's minds, building some tools that may not really be research funding. You can't get it done through research funding, but if a project can come together that really understands the individual nature of this and try to push that forward, that can help. Government's a bit of a black box to me, despite all the years I've spent working with government. So I don't know if I can answer that question well enough, Kathleen. You probably know better than I do.
Well, that is a wonderful place for us to end our conversation. So I am going to turn this over. For those of you that are interested, Rena has put into the chat some really helpful links. If you're interested in joining the Type 2 Diabetes Network, there is no cost to joining, and we have lots of resources that you may find helpful. So please do connect with us and join us and sign up for our upcoming discussions. And Jason got something into the chat about primary care networks and community health centers and the need to include them in this conversation. So I think that's also an excellent point before we sign off. But thank you, Diane, for this wonderful conversation and for your work in the area. And thank you to everyone who attended in person and all of you who are watching later on. And we look forward to the next one, which will be happening in March. Thanks, everybody.
Thank you, Krista.